Accepting and tolerating PAP therapy are key to its long-term success. To get a professional's perspective, we're speaking today with Dr. Kingman Stroll, who's the director of the Center of Sleep Disorder Research at Case Western Reserve University. Was there anything on how patients approach their therapy that made an impression on you?
I think the first thing is that a patient should try PAP therapy. Be willing to sort of take the risk, because this will help them feel better and help their cardiovascular physiology.
What are some of the common issues that arise with PAP therapy?
Well, there are four common issues. One is that really overcoming the idea that this is intrusive. The second was related to the mask and how the mask is fit. And the third is that of nasal symptoms, including sneeze, stuffiness, and drip. And the fourth is related to the idea that this is intolerant pressure, that this pressure, this PAP pressure, somehow is not feeling right to the patient.
How do you address the issue of intrusiveness?
Well, intrusiveness really is the idea of making this part of the routine of the patient. You have to make them aware of the equipment. You have to tell their spouse, their significant other, what the purpose is. You have to sort of have them have some ownership of this particular therapy. And that requires knowledge, education, discussion, answering questions appropriately.
What do people do about air leaks?
Well, air leaks are a function of mask fit. Sometimes you need a different size mask, larger mask, or a smaller mask, or a different type of mask, because your face is going to be different from other people, and your face and that mask have to fit properly. The fitting of the mask should be done in the same position in which you sleep, and so oftentimes that means you need to lie down to have your mask fit. And the pressure that's adjusted, the pressure in the machine that you use should be somewhere near your bed so that the tubing itself doesn't tug on the mask and cause a leak in the middle of the night.
How about nasal dryness?
Now, nasal dryness, and sometimes even the drip that comes from having positive airway pressure in your nose, that can be treated with humidifiers or medications, and you should talk to your physician and healthcare provider about that.
Are there any recommendations you can make about the pressure tolerance issue?
Well, the first issue that we address in terms of the pressure sensation is to see if this is the right CPAP setting for them. The right pressure therapy is important. We have to check with the titration to see that the machine is set to the right pressure. We can then look at whether or not the patient needs to be retitrated to have a different pressure, or look at other modes of therapy, like bilevel, to be able to overcome that sense of pressure that a patient may feel with PAP therapy.
Do you have to use PAP therapy every night for it to be effective?
Well, if you don't use PAP therapy, you get your apneas back. You will have apneas if you don't use PAP therapy. So using it every night is important in reducing the number of apneas that you have over this night, that night, and the future nights you'll use it. So using it on a regular basis and making it part of your bedtime routine is the most effective way of achieving the benefits of increased vigilance and cardiovascular health.
How can patients make PAP therapy a part of their lives?
Well, I think they have to focus on the outcomes that they want. They have to focus on how they felt before they were diagnosed and treated. Focus on those issues, such as their lack of energy, their lack of vitality, the way that they couldn't interact intimately with other people because they were too tired, the idea that they were having difficulty driving a car or making business decisions because they were too sleepy. The other is issues of cardiovascular problems, that is, exacerbations of breathlessness because of heart failure, exacerbations of chest pain at night. Those outcomes are the focus for what they should think about as the best results for PAP therapy.
Well, Dr. Stroll, thank you very much.
You're welcome, John.
As we come to the conclusion of this final edition of Inside OSA, I would like to thank all of the patients who so generously shared their time and experiences with us.
They did a marvelous job, Sherry, and thank you also to the many sleep specialists and home care providers who help us understand the challenges and triumphs of people adjusting to life with PAP.
We hope that this series has helped you to take an active role in your treatment and that your therapy helps you regain a healthy and more productive life.